Now, this isn't normally how I start my interviews, but the report that you did into maternity services recently had a really big impact on me, and I'm sure it did on lots of other women who've given birth, relatively recently. So I did actually just want to thank you for being so unflinching in your findings, in the failings into maternity services in Shrewsbury and Telford. And I know you're doing a review into maternity services in Nottingham as well now. Have things changed since your first report?
So I think that we have seen some changes, some positive changes since my first report. Of course, the report identified the need for £350 million in funding, and the government fully endorsed that report. NHS England have now increased funding into maternity services by 180 million, so we can say we are halfway there. There have been some improvements in workforce, and I do see a lot of good practice in units I visit around the country. But I would say there is very much more still to do.
And what do you think should be done then?
So I think the most urgent priority now for maternity services across England is a fully funded workforce plan. The Health Select Committee report, chaired by Jeremy Hunt when he was chair of the Health Select Committee, identified this need for funding. We are 2.5 years down the line since that was identified, and being only halfway there is not good enough.
We've just had the autumn statement, and, their projections are based upon a real squeeze in public spending, particularly once inflation is taken into account after the next election. You're calling out for more funding for a workforce in the NHS, midwives, doctors, nurses. Are you worried about those spending projections?
Yes, I am. And of course, what we also need to acknowledge is that we are spending money on maternity services, but we're spending it through claims. So we're not putting the money we need into care provision, in my opinion, but we are, and NHS Resolution tell us this in the reports that they publish, we're spending the money anyway in claims. And so it is a false economy not to provide our maternity services, maternity and neonatal services across England with the funds that we know that it needs.
When you say claims, I'm probably being really slow here. You're basically saying people suing the NHS, is that right, for negligence?
Yes, absolutely.
So in other words, if you had a proper service in the first place, you'd be saving money because through the legal side of things?
I believe so, yes. Now, I mean, a number of these claims every year will be to support families, perhaps in the care of babies who are brain damaged and may well need care for the rest of their lives. And if women, do sustain significant injury or harm during maternity service provision, then yes, they should be compensated. But it is a false economy if we are continuing to spend such significant amounts of money on compensating for the damage, when better investment in the first place would, in all likelihood, significantly reduce the amount of money we are spending on claims.
What kind of, what we just touched on there, the claims that are coming in, babies being left brain damaged, what kind of things were you finding when you were speaking to the families?
So I have met, I'm sure now, with thousands and thousands of families, and I've met with all kinds of families who have had all kinds of poor outcomes. And I think it is important to say that not all poor outcomes can be prevented. And we did show that, in our report into the Shrewsbury and Telford Trust. But what I see when I meet families is that they're often exhausted, they're grey with exhaustion. There is just something about a family who have suffered, so significantly. And I think also it's the lifelong effect of an incident that perhaps has been catastrophic. I've heard of marriages breaking down, families, split apart. Siblings suffer as well if the brother or sister that they thought was coming home doesn't come home. And so I think we need to be really clear that when harm happens in our maternity services, it isn't harm that's happens today, gone tomorrow. Families have described to me, and these are the words of a family I spoke to recently, Donna, it's us that are serving the life sentence.